Hi, this is Dr. Kang's Scuba Diving Stories, and today's story is about diving related facial palsy. If it is really diving related, the correct medical term should be facial baroparesis. This is the question I got from on SNS. I felt some pain underwater on ascent, and as I exit the water, I found my face is paralyzed. I am at here and there, and please help me. And he also asked if he can dive in this state. This is the whole capture of our dialogue. And also I had another phone call from Mr. Chun, the diving instructor at Bohol, Philippines. He had a visitor whose diving profile had no problem at all, and after diving he had more than 24 hours of surface interval, and all of a sudden the facial palsy occurred, and seems like he was sent to the chamber and gone through the chamber therapy twice, and it's getting better. And the question itself was about, is it okay if he flies back to Korea? And I decided I will make some presentation on this issue. So to talk about the facial baroparesis, or diving and facial palsy, it's a facial palsy during and after diving. Causes and anatomy, symptoms, management, and is it okay to dive? And also I will talk a little bit about the facial paralysis, like Bell's palsy with unknown origin. So if somebody has Bell's palsy and is recovering, then when can he or she come back to diving? Facial baroparesis. It's a sudden facial palsy during and after, right after diving. It usually occurs when you ascend, and it's usually unilateral, lucky enough, and more luckier, it's usually self-limited. To talk about the cause, we need to understand the facial nerve, which is the sixth cranial nerve, and this particular nerve in middle ear cavity, I will show you the picture later. The nerve is covered by bony canal, but in very rare cases the nerve is exposed without bony membrane or bony covering. Sometimes the nerve is exposed and covered only with a very thin membrane. So if there is some pressure change in middle ear, the pressure can press the nerve, and somehow the blood supply to the nerve is blocked, and then the nerve shows paralytic episode. So it is usually temporary, but in rare cases some irreversible damage can happen. This is the picture of facial nerve. We have a temporal branch, zygomatic, and buccal, mandibular, and cervical. So we take 대장부 만세. It's easy for us to remember when we were in medical school. Now this is the picture showing, let me bring this part up. Okay, this is the stapes of the ossicle, and now here's the facial nerve passing the middle ear. Somehow this nerve is passing through the facial canal, which is bony canal. So even if there's some pressure, it doesn't really bother. But as I told you, rarely some people have no bony canal. They are exposed as just a nerve, or sometimes covered with very thin membrane only. So this is the reason that facial paralysis can come after diving or during diving. Symptoms are what you can expect as numbness, paresthesia, weakness or paralysis, for sure, yes. The sensation decreases on the face, and in a very abrupt and very bad case, which is very rare during diving, the facial kind of droop down. But this can happen only when you had a long episode of facial palsy. Okay, how are we going to manage this situation? This is usually, you can feel it while you're diving, but it's usually seen after diving. Symptom remains briefly, and usually spontaneous resolution is the course. But to rule out stroke, infection, particularly the virus, herpes zoster virus, there can have been some trauma, or it can be decompression sickness. So to rule out these cases or these situations, you need to see doctor immediately. Otherwise, it may result in permanent paralysis. So to differentiate between baroparesis and decompression sickness, onset usually underwater. DCS, it's within 6 hours post-dive. Symptom usually resolve spontaneously. DCS, the symptoms last longer. History. You have had some equalizing problem underwater. Or in DCS, you may have had some wrong profile. So usually treatment for baroparesis is wait and see. And for DCS, you need to go to the hyperbaric chamber immediately. So you had baroparesis, and can you dive? Actually, you can resume diving when paralysis is resolved, but it is more advisable that you go under some electronic neurogenic tests showing the nerve came back 100%. But I don't think people will do that. But it is recommended that you take the test first. This is a recurrent disease because you have some anatomical problem. Your facial nerve is exposed in middle ear cavity. So if you have the same problem, having some pressure problem in the middle ear, the same thing can happen. The same disease happens when you're flying as well. Also, if you have any equalization issue, you should not dive. That was the reason you had it to begin with. If you have had a decompression sickness, you have to wait until the paralysis is completely resolved. And also you have to go through some electronic and neurologic exam to show that the resolution is 100% complete. Here's another question on dive web, and it says that an open water diver student suffered facial palsy 2 months ago, and it is getting better now. When can he dive? Yes, surely he can dive when facial palsy, what we call Bell's palsy, you have to wait until complete the resolution, of course. Physically and neurologically, electronic tests should prove that the recovery is 100%. Otherwise, you have some biting problem underwater, biting your mouthpiece. If you have any paralysis around your lips and mouth, water can find its way into the oral cavity, can cause some salt water aspiration syndrome and others. So you really have to wait until you are cleared by doctor who does the test. So today I talked about diving related facial paralysis, particularly facial baroparesis, and my recommendation: do not dive when you have any equalization problem, and please stay away from water if the paralysis is not 100% completely resolved. And thank you very much for listening, and I'll see you soon.